So now moving towards the histopathology of the pregnancy-associated gingival overgrowth. In this, it is the formation of angiogranuloma. It is referring to the vascular changes and the fibrotic process that is occurring in them. Okay, so basically the tumor-like enlargement present on marginal gingiva actually is the mass of the connective tissue, and there are numerous diffusely arranged newly formed and garrowed capillaries, which are lined by cuboid endothelium cells basically, and they have moderately fibrous stroma with a degree of edema and chronic inflammatory infiltrate. The stratified squamous epithelium is thick. The retipegs are basically prominent, and intracellular and extracellular edema. You can see a prominent intracellular bridges and leukocytic infiltration. How will you treat this patient is actually basically related to the hormonal changes during pregnancy. So first of all, you will prescribe the patient a very good oral hygiene. Okay, the removal of the plaque and calculus basically, and it should be in the second trimester. Always remember that any treatment during pregnancy is only done during second trimester, not in the first trimester and the third, because they are in first trimester the organs and everything are developing, and in third trimester it is also because everything has been developing, so you can know, but the second trimester you can do it. However, the removal of the gingival overgrowth regions without establishment of an optimal oral hygiene ensures recurrence. If the patient does not maintain the oral hygiene, so there is chances of recurrence of the gingival enlargement. Okay, but if there is actually good oral hygiene, so there will be a reduction in the size of the gingival enlargement, typically follows during the termination of pregnancy, and complete elimination of the residual inflammatory regions. And gingival overgrowth requires removal of all plaque deposits, elimination of factors that favor the accumulation, and also some fibrotic cases gingival intervention. Basically, treatment for pyogenic granuloma consists the removal of the lesions and elimination of irritating local factors. The recurrence rate of pyogenic granuloma is about 15%. Okay.